Hi everyone, I'm Dr. Antonio Zaffiro. I'm a specialist in plastic, reconstructive and aesthetic surgery. I'm a teacher in aesthetic medicine, and I'm a speaker in several national and international congresses. Today, we are going to talk about the bioregeneration program, which is a medical treatment Xcelens has developed to prevent and to treat the skin aging signs. As we all know, skin aging is a process that occurs in time as we grow old, and it is characterized by a progressive decrease in collagen fibers, hyaluronic acids, elastic fibers in our skin. The bioregeneration program has as target the ECM, extracellular matrix, which is a scaffold composed by glycosaminoglycans, proteoglycans, hyaluronic acids, elastin fibers, where cells can survive and proliferate and can be stimulated to produce the same components ECM is formed, especially fibroblasts. And there is a mutual relationship between the ECM and fibroblasts. The fibroblasts live within the ECM and they are stimulated to produce the components of the ECM. Every time we see the patient, we have to use a different product in order to prevent addiction of the skin to the product. So the bioregeneration program by Xcelens uses three kinds of products: Molecholin, Genialift, and Dublex. Today we are going to use Molecholin, which is a product composed by hyaluronic acid fragments, 6 amino acids, and kolin. Thanks to its composition, Molecholin has a Botox-like effect and helps us to treat all those sagging areas such as face, neck, décolleté, inner arms, abdomen, inner thighs and knees. The box contains 5 glass vials with 5 ml of product in it. I usually use 1 ml syringes and I withdraw 1 ml of product every time because according to me it is more handable in my hands. Here we have our patient. She's a girl, 77 years old, and she has never done anything for her skin. As you can see, she has a gray skin, a sagging skin in her face and neck, and has so many wrinkles in the décolleté area. She's a perfect candidate for our bioregeneration program, starting with Molecholin. Okay, we have already removed her makeup. We proceed with disinfection of the area we are going to treat. I stretch a little bit the skin, and the injection is very superficial, intradermis. I use a 30 gauge 4 mm needle. You can recognize how superficial I am because you can recognize the product through the surface of the skin. We can also treat the periocular area. This little bolus will vanish in 30 minutes, 1 hour. I used 1 ml of product to treat her mid-face, forehead, periocular area, zygomatic area, cheek, and jawline. We also stretch the skin, especially when it is so sagged, and we inject inside the venous collar. Very superficial injection. I'm injecting every 1.5 centimeters, 2 centimeters apart. All the way around the neck. And submental area. I usually use 1 ml for the treatment of the neck. Once again, the injection is very superficial and you can see the product through the surface of the skin. Now we are treating the décolleté area. The technique is the same. I'm stretching the skin. The injection is very superficial, as you can see. Injecting every 1.5 centimeters, 2 centimeters apart. The procedure is painless. We have just some redness but no bruising because we are in the right plane. And we are covering all the area. For the décolleté, I usually use 1 to 2 ml of products. The treatment is done. The patient is okay. Are you? Okay, perfect. Just some redness, which is quite normal. And now we are going to put some healing cream and the patient is ready to go home to her life. She's a middle-aged patient. I already know her because she has started her bioregeneration program 15 days ago. She had her doublet session. Today we are going to perform the Molecholin session, and in 15 days she is going to have her Genilift session. After that, in 1 month, she is going to restart the bioregeneration program with another session of doublets, 15 days apart Molecholin, 15 days apart Genilift. Today we are going to treat the lower third and mid third of her face. We are not going to treat the forehead because she has had her Botox 2 weeks ago. We are going to treat the periocular region, the lower eyelid and crow's feet. Then we are going to treat the neck and the inner arm for the sagginess in this region. We have removed the makeup, disinfection. We have to clean very well all the areas we are going to treat. So the face, the neck, and then we are going to clean the arms. We can inject along the jawline. We identify 4 points of injection. 1, 2, 3, and 4. Then we go upwards in the cheek. 1, 2, 3, and 4. The injection is very superficial in the superficial dermis. We stretch while we inject. Now we are in the zygomatic area. 1, 2, 3, and 4. The lower eyelid. Very superficial injection. You can see the product. We stretch the skin while we inject, and we use a 30 gauge 4mm needle. You have to be very careful in this area because bruising can occur. So we treated half of her face. Now we are going to treat the neck. The technique is the same, so very superficial, stretching the skin along the venous collar. These blebs will last for 1 hour and then vanish. We can use the bioregeneration program to treat the laxity in this area, the inner arm. The area to be treated is this one. And we can just identify few points, 1 centimeter, 1.5 centimeter apart. And I suggest to use at least 1 ml, 1.5 ml of product per side. The technique is always the same. Stretching the skin and injecting very superficial in the superficial dermis. It's a very easy and fast treatment. I have some products left, so I can use it to cover all the area. She's a young patient, she's not even 30, and she has started her bioregeneration program. Does she need a bioregeneration program? Well, the answer is clearly yes, because this program allows us to prevent all the aging signs in her skin. As she's very young, we are not going to treat all the surface of her face, but we are going to use a specific technique, which is the BAP technique. We are going to identify 5 points per half face. First point, the jaw angle. Second point, protragus area, just 1 centimeter apart from the tragus. Third point, zygomatic area, 1 centimeter outside and 1 centimeter downwards, the external canthus. Fourth point, the labial mental area. And fifth point, the nasolabial area. We are going to inject 0.02 ml of product in each point. So we stretch the skin. The injection is very superficial. So I'm going to deposit a bolus of product. Second point, jaw angle. I am using a 30 gauge 4 mm needle. The treatment is painless, very easy to perform, and very fast. Are you okay?
Yes.